day to you. My name is Dr. Charles Ford, and we're here today and assembled to try to help you with your voice disorder. What we've assembled is a team approach to solving the problems that you're having either with speaking or with singing. As a physician, I'm what is referred to as an otolaryngologist, head and neck surgeon, and the treatment of voice disorders rests squarely on my shoulders. I'm going to have each person on our team introduce themselves and explain the impact that they have in treating you. As a doctor, most of the time you'll enter into the system in my care, where I will evaluate you and diagnose your medical and surgical problems.
And I am Dr. Priscilla Porterfield. I am a teacher of voice, teacher of singing, and occasionally, as is the case here with Tess McNabb, I have the opportunity to work with singers who have had vocal distress in one form or another. And in this case, I have had the honor of working with Tess and taking her from phonating easily over a period of months to then returning to her ability to sing, which is her end goal in this case, because she is a singer who has undergone vocal distress.
I'm Melissa Grady. I'm a speech-language pathologist, and let me clarify speech-language pathologist, because most of the time people hear that and they think I'm just deal with speech. And in this case, with Tess, I'm dealing with voice disorder. And my role in this is to assess and to find out the specific kind of vocal problems that she may have in conjunction with the diagnosis from Dr. Ford. And also, I also design and implement a program to reduce what I find, which could be vocally abusive behaviors, and I experiment with different specific normal voice facilitating techniques to promote healthy, normal, and improved voice, and to use those techniques and to teach the client, which is today we're discussing is Tess McNabb, and a help to also increase breath support for speech, increase vocal intensity, and to promote a healthy voice and to get it back to a normal speaking voice so that we don't get back to where she was at the beginning.
And I am a patient, Tess McNabb, and in the beginning I started with absolutely no voice, and then when Dr. Ford diagnosed me, he diagnosed me with vocal cord nodules and reflux disease and allergy problems. So I have been under the care of these folks in this team, and they have been able to bring back my voice. I also am a singer, so it's very important to me that I have the opportunity to learn to speak, not only speak, but to sing again, and they have been able to bring that about for me.
I'm Stan McNabb, spouse of Tess, and my important role is a support person. And but first I need to digress and say that the first time that I heard Tess sing was in 1952 at our local radio station, and 5 months later I moved in next door to her, and so I have listened to her practice in the mornings before we went to school, on summer days when she had her windows open. So I've listened to her sing for many, many years. And so it was very important to me to help to support her, to get her voice back and her singing voice back.
So what is the purpose in creating this DVD for you? Our purpose is really to give you some hope. We want you to know that through the use of each person here in a team effort, and your dedication, your efforts, and your commitment to restoring your voice over a period of time, we should be able to give you a much better voice, both for speaking and singing. using this format, we have a real patient in Tess who had this problem with her voice disorder. Now, Tess, about how long ago was it that I saw you in the office?
I came about 3 years ago.
3 years. So immediately you know that the solution to this problem is not an overnight solution. You can't expect to come with a voice disorder and be cured in one visit. Problems that Tess indicated that she had were allergy, acid reflux. She also was diagnosed with TMJ by Melissa. Other problems that patients have are very common, such as muscle tension, dehydration, viral illnesses, use of alcohol and tobacco, and then, interestingly, they develop compensation habits that can lead to worsening problems, and Tess also indicated that she had vocal nodules. Now, the treatment for most of these disorders is medical. Although I am a surgeon of the larynx, which is the voice box, rarely do we employ surgery to solve these problems. This is why we have a team approach. So the first step that I'm usually going to take, besides prescribing some medication, possibly allergy testing a patient, is to refer them to a speech-language pathologist. And so, Melissa, could you just give us a little idea of your approach to the patient like Tess who has a voice disorder?
Yes. First off, I assess to see what behaviors, like vocally abusive behaviors, because that's usually an indication. And that could be anything from excessive talking or singing, yelling, excessive or chronic cough or throat clearing, constant talking. Tess will tell you that's part of it. Sometimes smoking, which was not in Tess's case. All of these things, I usually ask a patient to start tracking and graphing their behaviors throughout the day. And we go from that approach to trying to decrease what is happening. And also I take the diagnosis from Dr. Ford, which was the vocal nodules, the hoarseness, fibromyalgia symptoms, and allergies, along with her secondary characteristics, which were the throat and facial tension, which helped me to pick up on some of her TMJ issues. Then I refer her to a TMJ specialist, and also I look into recommending vocal rest. For example, with the vocal folds are like thin layers of tissue, and it's like they go together just like clapping, and if you clap a lot, you know, it can also be damaging. Also, I work with inhalation, phonation, relaxation training, and whispering upon phonation. And with Tess, could you tell me where we started?
Yes, we started with easy onset because I had no sound at all, and it was very distressing to me. And so you really wanted me to relax, and you gave me exercises to do that, and you showed me especially facial and neck exercises, which really were very, very helpful. And it took a lot of thought and time and patience because you don't have instant gratification in a situation like this. So